How long have you been sick?
For about a week.
Yeah. Okay.
Quicker access to patient information is one of the benefits that practitioners notice when they begin using an electronic health record system. Clinical data, such as lab test results, radiology reports, and hospital discharge summaries, can be retrieved with just a few clicks. Getting that information into the EHR can be a much slower process. As clinical data arrives at a physician practice, often on paper or by fax, staff members spend time scanning it and attaching files to the electronic record. Now, there is a faster, more efficient way to manage the flow of clinical data. Vermont Information Technology Leaders, a nonprofit organization, operates a statewide, secure computer network for healthcare providers. Hospitals, independent labs, and other data sources use this network to send clinical information to EHRs in electronic format. Practitioners receive clinical data in their EHR inbox and review it before deciding whether to make it part of the patient's electronic record. Identifiers in the incoming data are used to automatically route it to the right patient chart, much more accurate than manual filing.
That was a huge issue for us, where patients who say, geez, I had a lipid panel, but you can't find it, got misfiled on the wrong chart. With this, it's always available. It's always direct, because it's directly linked to the patient ID number, it's always in the right chart. Anything that involves taking a paper copy, making notes on it, sending it to a pile to be scanned and then put in another record somewhere else, or put in the record somewhere else, is time-consuming, it's labor-intensive, and it opens up the possibility of something being lost. So anything that comes back as an electronic form that can be linked to the chart automatically, a radiology report, a specialist consult letter, a discharge summary, I think that's hugely beneficial.
VITL is working with all of Vermont's hospitals on electronic data delivery. With medical treatment decisions hanging in the balance, it's critical that practitioners receive lab test results as soon as possible. VITL's network transmits results immediately upon test completion.
We were able to decrease our turnaround time significantly. In many cases, if we receive a sample during the day, they'll have that result before the practice closes so that they can notify a patient if they need to change a course of treatment.
Test results usually appear in the practice's EHR within seconds of being completed at the lab. Numerical values are placed in the appropriate fields in the EHR.
The data comes in error-free. Second is it comes in structured so that practices will spend less time doing data input and can spend more time doing data analyses and population management.
The lab results come back as discrete data, so instead of a scanned sort of paper copy, we get stuff that is actually usable. So for example, we'll get total cholesterol, an actual number that goes with it, and those numbers can be tracked over time. They can be graphed, which is nice. You can look for trends. The other thing that's nice about discrete data is it can go on a flow sheet, so we can automatically track on our flow sheets hemoglobin A1C. So if you want to see when and what the last A1C was, click on the flow sheet and it loads on there automatically, so there's no steps in terms of adding dates or values or anything like that.
When practitioners enter the exam room, if their EHR contains electronic data delivered from VITL, it means they have more complete information to discuss with the patient. It also means less time is spent preparing for the visit.
I'm having to request less labor time from other coworkers because I can solve the problem on my own and I have all the information at my fingertips. So when I get the lab work, I already have the chart, I already know all the information about the patient, and I already know what the next course of action is going to be within, within being done of having reviewed the lab. So that has cut back the number of phone calls, number of interactions with the staff that were necessary for pulling information.
Practices connected to VITL's network receive outstanding technical support from VITL's team of experts. Support begins even before a practice is connected, as a VITL project manager works with the practice and its EHR vendor to install and test interfaces.
We are here to help practices during the implementation process of various interfaces, and we help coordinate all the work between vendors and practice and hospitals or independent labs. We also work on state registries like a Blueprint for Health or Immunization Registry, and we help practice complete those interfaces and on time and with our expertise in this field.
Once a practice is connected, computer interfaces are constantly monitored. VITL support staff receives an automated alert if there's a problem and uses state-of-the-art tools to determine what's wrong and fix it quickly.
And many times we're able to actually resolve the issue before the customer even knows that there's a problem because these alerts notify us in a timely manner.
Vermont physicians are using electronic health record systems every day to improve patient care. Connecting to VITL and having clinical data delivered electronically is the next step you can take to make your patient care more efficient and effective. To learn more and to get connected, please contact VITL today.